Mhm.
All right, I've got 11:02. Dr. Carter and Caitlin, should we start up?
Yeah, let's do it.
Yes. So good morning, everyone. I'm glad you all are here at our CCCT meeting here in February. I think this is an exciting time because we're going to start to formulate how we're going to really move forward. So before we get into this meeting, I just wanted to, and I'm going to let Caitlin do this because she's so much better than I am at making sure everybody is recognized and that we break ice and all that sort of thing. But I just did want to say good morning, and I'm going to hand it over to Caitlin.
Yeah, absolutely. So I think how we'll do it, just now that sort of we're established and there's a lot of people on the phone, just go ahead if you would and introduce yourself in the chat and tell us your name and your organization. And if this is your first time on a CCCT meeting, please go ahead and come off mute and introduce yourself.
Can you hear me?
Yes.
Hi, everybody. I am Cherie Campbell. I am the engagement director here at Maryland Information Network, and we power the 211 network. Nice to meet everybody. This is my first time.
Yes, and hopefully the first of many. We're so excited to hopefully partner with you.
Yes.
So Cherie is our guest speaker today. So we're excited to have her. Is there anybody else who's on for the first time? All right. Well, please continue to introduce yourselves in the chat. Thank you to those who have already. All right, so I can go through our meeting agenda. So today we've already accomplished number 1, so we're off to a good start. And after that, we'll talk a little bit about our goals as a CCCT, and specifically the goal that we're going to get into today, which is around our community resource inventory work. And then we'll have Cherie from Maryland 211 speak about 211 and kind of what they do at the state. I know a few of you discussed 211 as a good resource, and so we're excited to have her here today to learn a little bit more about the current state of 211 and how we might partner with 211 to help build out the resource within our county. Then we'll turn to community announcements. So I don't know, Kim may have some, and then if there's anyone else who wants to talk about anything exciting going on, celebrate some wins and accomplishments, and then we'll talk about our next meeting and break for the day. All right, so this is our mission and vision. I know you guys remember this. You want to go to the next slide? I'm not going to go over it, but it's in your notes. All right, so we, as you guys know, in the past 2 sessions, we did that initial Jamboard planning session where we came up with like globally what our issues were and where we wanted to focus. And then we came back and we, the sort of leadership team, categorized those into some specific areas. And then I know I wasn't here, I don't think the last meeting, but we got into the nitty gritty of how we might start to address those. And we took all of your input from last time and developed some actual goals. So of course, these are, you know, open to your feedback, but we feel like this is a pretty good place to start, especially with having 211 today. So I wanted to just frame up that where we felt like we are going with community resource inventory work to help guide you guys for any specific questions you might have for Cherie or for just us as a group in general as we move forward. So the goal, the overarching goal that we wrote or came up with is to identify and improve connectivity with existing community health resources. So we heard this kind of across the board, different areas. It's hard to know what resources are out there. It's hard to make sure that the contact information there is accurate, and it's hard to know who they serve and to connect with them in a sort of efficient way. So we feel like this is a really good goal to focus on for CCCT, and we built out some strategy steps. The first strategy would be to select a community resource inventory. We are, of course, joined by 211 today, which is a community resource inventory, and specifically the one that has been invested in heavily by the state of Maryland. And so there's a lot of things happening in the area of 211. So they're a great resource to kind of frame up our discussions around CRIs. And then strategy to invest in ensuring that the CRI is comprehensive and accurately reflects resources in Prince George's County. And the reason that we wrote this specifically is because I went to a presentation at the Maryland Rural Health Association conference back in October. And sorry, I think someone needs to mute. Thank you. So I went to a presentation back in October of the Maryland Rural Health Association in a different county. It was Charles County, actually. They presented about how they were able to partner with 211 to really work to make sure that all the different community resources in their counties were captured within the 211 system, and to build it out into a resource that was really useful for them. And so we intend to do that in Prince George's County. Either, hopefully with 211, we're going to learn, not committing anyone to anything. We're excited to talk to Cherie more today, but we've heard great things from other counties about what that process can look like. And then strategy 3, implementing the community resource inventory in community health worker workflows, care coordination workflows, just the workflows of all of you all on the phone, both in terms of just so how you do your work, but also from an IT standpoint, making sure that systems are interoperable, nobody's double charting, stuff like that. And then advocate to address the gaps in community resources. So once we identify that, maybe once we've, all come together and built out all the resources around housing, there's really not that many. And so we have now standardized data and a comprehensive inventory to show the gaps and then use that for advocacy efforts. That's more of a long-term goal, but that's where we see this going. And then our second goal, which we're not going to talk about too much today, but we'll get into in the future, would be promote data sharing between partners. And I know that inclusivity was a big topic that we came up with also. And we kind of felt like those could be inclusivity and sort of tailoring resources to specific populations could be baked into what we do in goal 1 and goal 2, kind of just like underpin all of our efforts. So with that framing, can we go to the next slide? I will introduce Cherie. So Cherie is, I'm gonna read your bio, brings over 20 years of community outreach experience working with education, healthcare, and other community cornerstones. She previously worked with the Howard County government's Department of Community Resource and Services Coordination Team and won the 2021 Contingent of the Year Award. Congratulations. She is an active member of the Racial Equity Alliance in Howard County, the Getting Ahead and Just Getting By world, and Getting Ahead While Getting Out and Our Rules. So we're super excited to have Cherie from 211 on today. And Cherie, I will turn it over to you.
Thank you. Hi, everybody. I hope all is well. Let me see if I can share. I'll just jump right in. My presentation isn't an hour long. It's more like 15 minutes because I do it so much. Might be 20. And then I'll open it up for questions, all kinds of questions, and we'll take it from there. Do you see my presentation?
Okay. Yes.
Good deal. I did it right. Okay. So, of course, we are the Maryland Information Network, but most people know us as 211 Maryland. We are a network. We have about 6 call centers that, help us do everything that we do in this state, which is wonderful. We have great people that work with us. We work with amazing partners and organizations that help us get done what needs to get done to get the resources to Marylanders that need the help. So I think some of you may be familiar with 988 that has rolled out. Before that, it's kind of grandfathered into this. We had 211 Press One. And so now that has moved over to the 988. Our call centers are still taking those calls. It's all the same. We're just trying to, get people the help that they need. So nothing has really changed. It's all still the same. I know that there was some confusion on, well, did Press One go away? Well, the name went away, but 988 is still essential in servicing our people that need the help. You can also go on search.211md.org to find information that you all may need.
Gracious. 2014.
So we have our MD Ready program. You can text 211 MD1. That's for any weather related flood, flood related inclement weather that's coming that might be too much. We have a way to get that information to Marylanders very quickly based on what it is. This was instrumental around COVID. So that is something that was kind of born out of that and is just, I guess, here to stay now. So we have a partnership with the Department of Aging, and it's developing and it keeps developing. So they have the MD Aging texting platform where they're able to send text to their constituents on an upcoming program that might be going on, anything that they need to get to their people. One thing that was born out of that was the Maryland Access Point, which is a website. I urge you to go check it out. So they're able to work with their care navigators and really help people that need the help regarding aging. We've also ramped up our resource integration with the community-based organizations that serve those that are aging. So this is a partnership that continues to grow. There's some new things coming out. I can't talk about them yet, but they're definitely in development, and we're excited about it. The Stop Hate program is a program that was born from the previous administration, but it still is continuing because there were a group of people that were being targeted. And so they asked us, the state asked us to step in and try and help with a way that was, I guess, anonymous, where people can anonymously, report things if they are feeling, if they're in a tense situation, I'll say that. So people are able to either text and or go on our website and put a complaint in, whether they experienced a hate and or bias crime. And we are able then to forward that to local law enforcement for them to follow up. So they're not in immediate danger. If somebody says, hey, I'm going to call, and then that could escalate a situation, they're able to go ahead and do that anonymously. And then we follow up and forward that over to the local authority. So it's a good thing that it's still in use and people report. Unfortunately, I mean, that's not something that we want to say, hey, yay, but it's there, or it's a resource for people that need it. Another thing that came out, the state asked us to ramp up our resources when it comes to immigrants and new Americans. That is something that is a continuous thing that we're doing, and we're always looking for new organizations that don't know that we're kind of a hub, one central place that they can go to get information. So we're constantly updating this page and our resources to help those that are coming new into our state. Another program that we have is the Kinship Caregivers Program. We are developed with the Department of Human Services, which is Kin Cares. And so Kin Cares, you can text Kin Cares. You can opt in whenever you would like, just like with any of our programs. And this program allows them to get resources, whether it be a book and or a resource, or website resource for them to help those that are in their home. This could be a grandparent, an aunt, an uncle, a friend, just so they can go ahead and have that quick access to information for resources. So that's our kinship program. So Health Check was developed after Congressman Raskin's son committed suicide. And so this program is a program that says, hey, my name is Cherie. I need a call at 3 a.m. every Tuesday so you can check in on me. And so this is just one of those things you can opt in again and opt out whenever you want. So this is something that, was developed out of that, and it's still going on to this day. So it's sort of like, I want to say a therapist in your pocket, but not, just somebody to call and check on you, see how you're doing, make sure you have some support. If you need additional resources, we can forward you those resources and help you out. Our care coordination program, this was developed out of the Behavioral Health Administration partnership with emergency rooms. The Maryland emergency rooms have some of the longest waits in the country, so they asked us to step in. So we have, and we've stepped in, and we're trying to do our best to help the discharge planners, the local behavioral health. It's all the hospitals. We're all in cahoots together to try and figure out how we can get people where they need to be. Whether it's an inpatient bed, an outpatient bed, whatever resource that may be, we're trying to get those people where they need to be. We work with many people, many hospitals. There's different parts of the program as well. So if there are people that, may not have, they might not have a car to get to their appointment, we have funds that they'll be able to get there. If they need to go somewhere overnight, they are able to, we might have funds to have them housed in a hotel for a couple of nights until they can get to their appointment. So if you are in Maryland, because this question has been asked before, so I answer it. If you're in Maryland and you happen to be from Delaware, you are still able to use this program if you're here and you're experiencing that behavioral health problem in our hospital. So that's something that is able to be taken care of here. So that's our care coordination program. We have some other texting programs that help Marylanders when they are, experiencing some sort of mental health issue or episode. This is more of a support kind of thing. So you would text MD Mind Health to 898-211, and you will then be enrolled in a program that sends you encouraging messages every week. And so we also have this in Spanish, which is MD Salud Mental. And we also have this for our youth, which is MD Young Minds. So they are able to get the help as well. And I like to tell this story with Young Minds because I happen to be in a call center, and there was a child, I think he was in 7th grade, and there was a specialist on the phone with him, like coaching him before he was going to school. And he was like, I'll follow up with you after school. So the children are using these programs. And I love that because sometimes they feel like, excuse me, they can't talk to someone, or, we're just here all the time to try and help you. So that's an awesome thing. Data. We have data. I think everybody is collecting data. But for us, it's a little bit more. We know who is accessing. We know what the community looks like. If you have people on the call that are looking to apply for grants, or they're looking for social determinants of health needs and who that is and where they are, we have that data. And you'll be able to access it. This slide is just sort of an example of what you could pull, and where the populations of people are, and what they're accessing when they're accessing. Excuse me. We also have resource data by county. So this is where I've been doing a lot of work. So I'm working with different counties, just trying to get the information in our system. I'm sure that's why I'm here today, and why I'll be all over the state for the next few years. Because as we know, um, uh, organizations change, administrations change, and some people go out of business, things of that nature. So it's always a moving entity. So our statewide database, we're only as good as our local providers, and we're only as good as the info that you give us. So if we don't know, we try really hard, but if we don't know, we can't fix it and or put it in our database. So some ways that you can help is make sure your information is in our database. And if it's not, definitely contact me so I can get that to you. Use our system, give us some feedback, let us know if anything is broken. It is tech, things happen all the time. If we do something on the back end, it might affect the front end, so please let us know. Share your resources with your constituents, and invite us to things. We like to go outside. We like to play sometimes. So definitely invite us to your events, and we'll come. Any materials that you might need. If we can't come, we'll try and send what we can, to just have that information on hand. That's something that I've been doing with some of the health departments, making sure that they have some of our information. The health departments are really essential in getting the information out. They kind of touch everybody. And that, you can follow us. You can connect with us on all of these platforms. And that's about it. I'm Cherie, and do you have any questions?
I'm sure we have many questions. So thank you so much for this presentation. I had no idea that you all operate so many different programs. This is excellent. I think we probably have a lot of questions that are on sort of the care coordinator end of the system versus like the public facing end of the system. So I don't know, we had worked on some questions to ask. I don't know if anyone has any questions, or we can go ahead and kind of kick it off with some of the ones we were thinking about.
I have a quick question. My name's Crystal. I'm the special needs coordinator with WellPoint. The Maryland Access Point, is that also for individuals with disabilities or just for seniors? Those resources.
That's also for disabilities.
Okay, that's what I thought. Yeah, I am a little new to this role, so I'm still kind of learning what's out there, and I have gone on to that site before and given some of my families, the number for the county and things like that. But I'm excited to learn more about it. So thank you for this presentation and for
You're welcome. Ursula,
clarifying
I
that.
see the chat. You're welcome. Ursula, I will share my slides, I promise.
I wonder, Shree, if you might talk a little bit about how you've been able to work with other counties and like what specifically that partnership look like?
Yeah, so, oh man, I didn't even talk. Well, you guys need to hear this. One of our biggest things, you know what? I forgot to add it. So, one of our biggest things that we did was Midshore. Midshore has 5 counties, and that partnership was born out of us just trying to ramp up our resources on the Eastern Shore. And so we found the LHIC, the local LHIC, Nicole Morris. She's awesome. She's been awesome to work with. Um, and so we were just trying to figure out, okay, how can we do this? So I was going to the local meeting, and then they decided that they would apply for a grant, which allowed them to then do this big rollout. And one of the things, you can check it out, it's What's the 211 Hun? That is their local thing. It just launched on 211 Day. And so that's all about getting your resources in the 211 database, ramping up the resources in the database. So that was a long partnership that started last year under another program, and it kind of just grew organically, which I love those things. It grew organically into something that is really just going to help Marylanders get the resources that they need. So they applied for a grant. That grant was able to get 5 organizations that were big in serving the Midshore area. And they are throwing events, making sure that people are getting us the information so we can get that information in our database. It's a lengthy process, but it's worth it. One of the things that we found were people are just sitting around with listservs. They have Excel sheets and a bunch of documents. I think it was what was it? One of the counties. I think it was St. Mary's. And she's just like, I just have all of these flyers, and I just need to send you the flyers. And so we're like, okay, but we need a little bit more information than just the flyer. We need to know what this program is for, who it serves. So if you could put it in an Excel sheet and send that to us, it will be easier for our database curators to get that into our system. So yeah, that was the question, but I kind of did a little bit more. Sorry. I felt like you might need to know that.
No, that was very helpful. So it sounds like, I think, didn't Charles County kind of create like a form that they had people fill out? Right?
Yeah. So
Yeah.
there's a form that I send to people as well.
Okay.
But depending on, and we made it digital, or I can send you the PDF. Either way, we can get the information in our resource database. Excuse me.
Got it. And what does your, if I can continue asking questions, what does your integration with, do you have any, I know I sort of have heard that you're working on integrating with CRISP and maybe having some e-referral capability from the provider side. So can you talk a little bit more about that?
So I don't know everything about that because that's a little too techy for me, but I do know I do know that there is some integration happening with CRISP. That was kind of around the same time that we were talking, that we had our development with Midshore in the beginning and in Washington County. And I'm not sure if you know what, let me get back to you on that. Let me get
Yeah,
back to you
sure,
on that.
no problem.
Yeah, I will.
Do you
Let me
know,
write that
and
down.
let me ask you, and it's okay if you don't know, but do you know if the goal of that, I'm assuming the goal of that was to connect sort of the clinical side to the non-clinical side, right?
Yes.
Okay.
Yes. Mhm.
Okay, great. Who else has questions? I think Janet, you had one in the chat.
Yeah, I do. I was just going to jump on. So you mentioned in your discussion that you are able to assist with finding beds, and I missed a part of that. Is that hospital beds or just beds in the community? Could you clarify?
Yeah, so that's the care coordination program. So the care coordination program is a program, it's specifically for behavioral health. So if you need, for example, say there is somebody with maybe has autism and they're having extreme behaviors and they can't stay in the home. and they need to be in an inpatient facility. They would contact us through the care coordination program. They would either do 211 press 4 or fill out the form online, the hospital would, and then we would just assist the discharge planner with trying to find an inpatient bed for that client. So that's the beds that I was talking about.
Okay. And you work with each of the hospitals? I'm just interested. That's a little bit, how
Yeah,
do you
yeah.
get that information?
Yeah, so we have access to the bed board. We work with the hospitals. We work with community-based organizations. If they have beds for inpatient use, we work with yeah, we work with those people.
Thank you.
You're welcome.
Hi, this is Kim. I have a question around, is there a way for us to get a list of the existing resources in 211 that would be in Prince George's County? I know we shared our goals, and I think part of our mission would be to really boost that up and to have kind of some baseline data to start with, and to use that
Yes.
to figure out who's missing.
Yes, we could do that. Yes. Sometimes,
Okay.
I'm sorry, I was thinking through a lot of things. I was thinking zip codes, but if the zip code is in there, it's fine, it'll pull it, so it's fine. So I will send that request to our tech.
Thank you.
You're welcome.
And I see Sharon has hand.
Yeah, so I had a question about how you have worked with counties to compel the private sector to participate and send you information. I know, in some places they may require, if they have a county contract, they're required to complete the form and submit the information. I mean, do you have that kind of arrangement with any of the counties in Maryland?
So kind of. So some of the, are you talking from like a statewide place? Or I know you're talking county, but do you want to know how the counties are compelling people to get us the information?
Yes.
Okay, so for Midshore, I can speak to this. One of the things that they did, they wrote into their contract for these grants that you have to update your information with us, period. So that is something that is happening, well, because they signed the contract, but kind of organically as well. People want to be in the database. People want to be found. Some people don't want to be found, and they let us know that because they just don't have the capacity. But yes, we are having some people, organizations are putting that in their contracts if they want grant money to operate.
I don't have another question. I just can't get the hand to lower.
It's okay.
Very good.
So you kind of just mentioned this with the partnership with Midshore. I was going to ask how often the information on the database is updated or validated. So is that the responsibility of the individual organization to check in?
So our database curators kind of help with that, but yes, we love it if you would check your information. One of the things that is also written into one of their contracts is so they have a quarterly call, and during that quarterly call, it's just asked that you make sure that you go in and check your information, make sure if anything is updated. We know people leave, people come, so just make sure it has the most up-to-date information. If a program, might have lost grant funding and you don't have that program anymore, just let us know that. Otherwise, we don't know. So we try, but yes, we would like people to check that information.
And so from the perspective of our like community health workers and care coordinators who are on the phone is 211, because we saw the online sort of 211 system. We were thinking about it being similar to like Unite Us or Find Help, where the care coordinators could use it to identify resources, but then also hopefully to send those referrals over. Is that something the system has capacity for, or is it more just to find the information for the resource and then to provide that to the patient so that they can reach out? Just my question.
That it depends on the program that you come through.
Okay.
I know with care coordination, they do the referral.
Okay.
Yeah, it just depends on the program.
Okay.
Yeah, but mainly it's for people to, get the resources and then to contact the people that they need.
And what would that look like on their end? Like, would that be a website? Are they going to go to 211.org and put that information in? Or is that, I know you're kind of working on the CRISP integration, so maybe there's going to be some things that they can do through CRISP. Or is there like a sort of on I guess desktop application or phone application that they download? Like how would they actually interface with the system?
You mean with a referral or just trying to contact us, period?
With the referral.
Okay, so with the referral, let me think about this. I believe for care coordination, they can do that on a desktop. They can also call. So that is something that I guess on the back end. I'm remembering something with CRISP. I don't want to misspeak.
No,
but
that's okay.
I think that there is something that is coming that has our resources listed in a referral type form that they're building.
That's what we're super interested in. Yeah,
Okay.
I've heard about that.
Okay.
So I'm super excited about that. I too am not a techie, but it sounds awesome.
Yeah, I know that they're working on it. I just don't know where
Right.
they are.
Yeah.
I'll inquire though. I will inquire. I have
Thank
it
you.
written down.
I have a quick
You're welcome.
question. When a person uses 211 and they find a resource that they can use, does 211 provide you with the criteria for being able to utilize that resource? Because some of them have correct. I'm sorry.
Yes, if it's no, I'm sorry. If that information is in our system, yes. When we send you the information and we ask you to fill out all the information, we hope that you give us all of that information on the criteria that people need in order to access the resource. Well, anybody can access it, but if they can utilize the resource.
Right. So, and the other question I had is that if when we interact with 211, does the system, and this might be a technical question, so I'm not going to even ask you. I'm just going to ask you, how do I talk to the folks, the technical people who understand the underlying infrastructure? Do you have a name and that I could talk to some folks I could talk to there?
I could set up a meeting. What is the specific question so I can get you the right person?
I want to know if we're able to send a request to 211, can your system consume it? Meaning that it can take it in and populate whatever like your sheets or whatever you have. So say that we have a system that our community health workers put all this information in.
What kind of request?
I mean, you know how a person normally uses your 211 system, they fill out a form. But if we already have that information in a certain structure, I just want to know, can we work with your system so it can just consume that information and put it into your format so that you can link us to the right referral? You see what I'm saying?
Oh, you mean like an auto population? Okay, yeah, that's a techie thing. I'll get you to the right
it'll
person.
consume it and then utilize it. And one of the reasons I ask you that is because when we start thinking about how we work with our community health workers and et cetera, they're filling out so many forms. And so one of the things that we want to be, I'm cognizant, I'm trying to be, we're trying to work through in the CCCT is how to optimize their processes. And so that's why I would just want to know if so, then I can talk to your technical people about how that might be able to be done.
Okay.
Thank
I will, yeah, I will get back to you on that.
Okay.
Who should be my central contact? Or should I just, let me put my email in the chat.
Yeah, you can go through me, Cherie, for anything that you
Okay.
need to talk about with the rest of the group, and I'll make sure
Okay,
it gets back
perfect.
and forth.
Okay, thank you.
So Cherie, this group that you're talking to now, that the CCCT is a subset of our Prince George's County LHIC. So it really is this is really for the LHIC. So this is the same
so this is
type of
another
interaction you've
LHIC.
already had.
Okay.
And the person who leads the LHIC is Kim. So Kim is the person you're going to get to know very well, and of course you'll get to know Caitlin, and then everybody else. I mean, so I just want you to know that we're forming a partnership with you. I mean, once we go through our process here, but we're excited about the fact that you have this resource. We don't have to go out and get any private piece. Well, we're going to discuss it with the group, but it's just so nice to have this in the state. And then we can start talking about how we can integrate it into our workflows. Of course, that'll take some time, but how we can optimize using the 211 system and then help enhance it for Prince George's County. One of the things that's going to happen with Prince George's County, we're going to have gaps in resources. So that one of the reasons I asked you about the eligibility question, because some of our residents may have to go outside of the county. And they may, and some resources may say, well, we only doing county residents, or other ones may say, you understand what I mean? Now, the other question I had to you is, do you all interact any with DC, because there are DC resources and we have Prince George's County resources, and sometimes DC wants to refer some of their folks that, literally right across the line over to our, so and then vice versa. Do you have any kind of relationship with them?
We don't have like a formal relationship. I do remember someone from DC talking, there was a representative talking with us from DC regarding CRISP. So there is something that's happening, but I will say this, that we have DC, Delaware, Pennsylvania, West Virginia, Virginia some things are in our database just because some organizations touch
all of those places.
Yes. So
great. Okay. That's great. Thank you.
You're welcome. Margaret, you're up.
Hi, Cherie. That was a very wonderful presentation. Just had a question about the data and the outcomes. So as Dr. Carter said, the front end, being able to pre-populate and send a referral, but how about the data that you get regarding the outcomes? Was that referral able to be, completed? And then was the person eligible? So, we want to close that loop type deal. And especially, and then one of the other things was, because we're currently working on developing a behavioral health emergency crisis data dashboard. So, with the coordination piece, I think we're working very closely with all the hospitals. We have our mobile response, our 988 call center. So some of the pieces, again, we want to make sure we really give a comprehensive view of what that looks like. So that's the other piece. Like, how do we get that information for Prince George's County along that line so that we can make sure that we're including that in the data dashboard for them to make those kind of strategic decisions about where the gaps may be?
So I need to check on if there's any other program besides care coordination that closes the loop. so to speak. I know that we are in partnership with Find Help, who we're trying to integrate to make sure we're closing the loop, so to speak, on so many things. So that's something I will check on for you.
Okay,
I'll
thank
get
you.
that
Yeah, I
back to
just want to
Kim.
make, yeah, I just want to make sure that we're getting all the pieces. So, you know, that, because everybody, it's a constant, like, comprehensive continuum of care, and
Mhm.
making sure that we get all that data would be wonderful. Thank
Sure.
you.
You're welcome.
So that's super interesting about your integration. Do you have any more information about that partnership with Find Help?
No, but my tech person can. I feel like we should have and we need to have him here so we can have a bigger conversation
Yeah,
because he
yeah.
can answer all of those questions.
Yes.
So
Trust
maybe
me, I
we'll set up
understand.
a smaller meeting soon.
Yeah, that
I'll
sounds
check his
great.
availability. That's something that I'll do.
Who else has questions for Cherie?
I have another question if no one else hops on. So part of what our goals is to ensure our resources are inclusive for different populations. Is there a way, or does this already exist maybe, for us to add like tags or based on their inclusivity of specific populations, or if we could like tailor the resources? So for example, to say like LGBTQI friendly, or just including that information so that it's a safe place for people to go.
Yeah, I would put that in. I feel like there's something for in the eligibility piece on the back end. I'm trying to think of it. I can't remember, but if you put that in the notes, the database curators will see it and will know to put that in there. They might reach out to say, "Hey, can you? What exactly do you want for this?" So that's something that they can do. Excuse me.
I had one more question about the public facing side, and I think you may have talked about this, but I just wanted to clarify.
Mhm.
The feedback I always hear is that people can't, that resources aren't all in one place, and that people can't access it for whatever reason. So you're accessible by phone and
Phone chat, what else?
web
Website?
website.
The web, yeah.
I'm trying to figure out just how easy it is, and I think there are a lot of people in Prince George's County that don't have access to a computer or are not necessarily even computer literate.
We do not, but that's a good idea, Kim. Sorry,
What did
Sharon.
what did you put
She
in?
asked if we had an app. I'm sorry, I just answered out loud.
Well, I was gonna say they do telephones. I mean, that's sort of
Yeah. So, to your point, Sharon, we hear that too. We do hear that people can't find the resource that they might need. One of the reasons for that is some people don't want to be publicized. And on our back end, that's why it's one of those things, some people, they have the resource, but they don't want to be, they don't want to be seen by everyone. So you have to call. And that's just like a nuance that people aren't, they're not familiar with. But the resource is there. You just have to call to get it. Because some people simply, they don't want their stuff publicized. So that's one thing.
so
Sheree,
if somebody were in your system, I'm sorry, I'm just going to follow through with this a little bit. If somebody were in your system
Mhm.
and say they went online and looked and couldn't find something, is there a place where it says, if you're not finding what you need, call 211?
You know what? I'm not sure if it says that anywhere. I'll
Yeah,
follow
Sharon,
up
my
with you.
question was sort of along that same line, is like, is there, like, when they call, sometimes people call, but they're not sure what they're looking for. Do you say 211, press 1 for blah, 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 211, press whatever for, behavioral health? So is there like a guided
Yeah, there's a
telephonic?
guided, it's a
Okay.
whole phone, it's a whole big thing.
Okay.
When people call, they're directed based on what number they push. For example, press 4 for the care coordination program. We know that's going directly to the care coordinators. They're going to go through the necessary questions with the hospitals, and then, do what they need to do to get that patient referred. So I know there's that. If there's somebody that is not English speaking, there's a whole situation for that. So, I've seen it. I'm probably not explaining it very well, but there are guided courses, so to speak, for people to get to where they need to get to.
And I'm just going to go a little bit further with this. So I'm assuming that all of your folks who answer the calls are very well trained in sort of techniques to help people figure out what they need, because I think that happens a lot too, where they'll call and they'll go in with an idea that they need one thing, and then through a conversation and reflective listening, it'll come out that they actually really need something different. So can you talk a little bit about your folks and their training who answer the calls?
Yeah, they're trained to, how do I say this? I guess to be like crisis counselors. They maneuver with however the communication. I should have put that on there. There's a call that we play, and there was a lady who was calling she just needed a resource to get to an appointment. And it came out in the call that she had cancer and she needed some emotional support. So she was able to get, additional resources that helped her through that. And, because she didn't have anybody, she was all alone. So they are very well trained to handle any call that comes in.
Now, my final question, I promise, is if you have frequent flyers, is there
Yes.
a place where you keep data so that, assuming it's a different person that answers the phone, they could go in and look up the person and they can see sort of the over time, the calls that have come in and what this person is doing. And then if you have somebody who is a frequent flyer who might be in crisis, do you have a way to get them, either through the health department or behavioral health programs or whatever with the county, to make somebody aware of this person's existence?
I would need to check with some of our call centers, but I believe that they do. I feel like I've seen something that mentioned a frequent flyer. I do know in care coordination that they have mentioned this, so that is something that is around. Our phone system just recently changed, so I'm a little bit unsure on what our current phone system is doing and if they're housing that information within it or either in the call center.
Right.
So I'll have to check.
You guys may use iCarol, which is the big national information and referral system. And I think someplace somebody said that you did. So I was kind of curious about how powerful.
Yeah.
I'll stop now.
iCarol is our the resource database, but our phone system is different.
Okay.
Margaret, you had another question?
Yeah, I was just going to address Sharon. I know, because we're working on the emergency behavioral health crisis continuum, 988, the call center in Prince George's County, we do have sort of like a warm handoff to the mobile response teams because there's 8 of them, and then we're sort of doing that longitudinal tracking. It's still a process, and then there is a high utilizers meeting that's being conducted on a regular basis as well as case review. So there's a lot of systems connectivity around that. That's why I was asking about the 211 additional data to make sure that we're capturing, you know, all of that and not missing somebody that's using another resource that's not being captured.
Well, thank you so much, Cherie. This was super helpful and informative discussion. I know we only have 3 minutes left, so I'll turn it to Kim if you have any community. I don't know if you had any to share or if we'll just open it for everyone.
Sure, we can open it to anyone for community announcements. Well, the only announcement I have, and we'll share information with the notes later, is that we have our quarterly meeting. The Prince George's County Healthcare Action Coalition quarterly meeting is March 12th at 6 p.m. And we'll be focusing on the Behavioral Health Consortium grant with Prince George's County Public Schools and looking at some youth behavioral health and substance use data, and then just giving all around updates on our work group. So I will send out registration information, and then that our next meeting is March 28th. And then depending on kind of our behind the scenes next steps, we can explore some of the community health resources in Prince George's County based on what's existing in 211. So does anyone else have any announcements to make? Thanks, Taylor. Taylor just put the registration link in the chat for the quarterly meeting, so we hope everyone can join. And this one will be virtual. All right, Dr. Carter, any closing remarks?
Well, I really appreciate you coming out and giving us the information. I think this is very helpful. It'll allow us to start our infrastructure build, and I'm very pleased with the fact that we can do it with the state, and I think this is going to be very helpful in us going to our next step. So thank you all for coming. I really appreciate and look forward to talking to you the next time so we can get to the next step.
Thanks so much for having me. You all have a great rest of your week.
Thanks, Cherie. Thanks, everyone.
Thanks, everybody.
Thank you. Cherie, we'll follow up with you soon.
All right, thanks.
Bye-bye.